A hospital where 4 babies died within a few months has been told it must not carry out heart surgery on children until it improves. The paediatric heart surgery unit at John Radcliffe Hospital in Oxford should remain closed until the right mixture of doctors is in place or it links up with another unit, according to a report by the South Central Strategic Health Authority. 4 babies died within a few months of surgeon Chana Sali starting work at the hospital, a death rate 5 times higher than average. After the 4th death under his care in February, Mr. Sali raised the alarm, decided to stop operating, having already complained about the age of equipment and poor working practices. The investigation said he was not to blame for the deaths. Dr. Bill Kirkup is one of the report's authors.
We don't believe that it was due to any individual failure of clinical care. I think it's important to say that at the outset. But what we did find was that there had been poor planning and implementation around the decision to appoint an extra surgeon.
The investigation found that Oxford Radcliffe Hospital's NHS Trust failed to prepare for the new surgeon's arrival, and there was no senior cover to help him. When he raised his concerns, there were attempts to minimise the scale of the problem and to restrict knowledge of it. It was only when journalists began to investigate that the Trust took action. Catherine Fenton from the Strategic Health Authority apologised to the families of the dead children.
It's very important, I think, that we recognise how difficult this has been for the families. We've intruded within their grief, and at this point I'd really just like to be sure that we apologise unreservedly to those families.